हाय एवरीवन। आज हम लोग पढ़ने जा रहे हैं प्रिवेंशन मेडिसिन इन ऑब्स्टेट्रिक्स पीडियाट्रिक्स। ठीक है। सो बेसिकली दिस इज मैटरनल एंड चाइल्ड हेल्थ केयर. So the test of any civilization is the measure of consideration and care which it gives to its weaker members. Hi मम्मी. मम्मी आज हम लोग पढ़ने जा रहे हैं मैटरनल एंड चाइल्ड हेल्थ केयर. जब वुमेन प्रेग्नेंट होती है तो क्या क्या केयर करते हैं, और जब बच्चा पैदा हो जाता है उसके बाद क्या क्या केयर हम लोग करते हैं, तो वो पढ़ने जा रहे हैं. हाय मम्मी. सो in any community, mother and children constitute a priority group. In sheer members, they comprise approximately 71.14% of the population of the developing countries. In India, women of the childbearing age 15 to 44 years constitute 52.4% of the total female population. Children under 15 of age about 26.5% of the total population. Together they constitute nearly 57.5% of the total population. तो काफ़ी एक बड़ा population है जिसका हम लोग को केयर करने के बारे में हम लोग पढ़ रहे हैं. Women as well as children. By virtue of their number, mothers and children are the major consumers of health services of whatever form. Mother and children not only constitute a large group, but they are also a vulnerable or special risk group. The risk connected with childbearing in case of women and growth, development and survival in case of infant and children. Whereas 50% of all deaths in developed world are occurring among people over 70. 70 साल से बड़े का डेथ होता है 50% ऑफ ऑल डेथ इन डेवलप्ड कंट्रीज. पर द सेम प्रपोर्शन ऑफ डेथ आर अकरिंग अमंग चिल्ड्रेन ड्यूरिंग द फर्स्ट 5 years ऑफ लाइफ इन डेवलपिंग कंट्री. ऑलमोस्ट आधा बच्चा 5 साल कंप्लीट कर ही नहीं पाता है, उनका डेथ हो जाता है. Global observation shows that, hi mummy, global observation shows that in developed regions, maternal mortality ratio average at 12 per 1 lakh live birth. क्या है मैटरनल मोर्टालिटी, यानी माँ का मौत का जो रेशियो है 1 लाख बच्चा पैदा करती है तो उसमें 12 औरत का डेथ हो जाता है. और इन डेवलपिंग रीजन द फिगर इज़ 232 फॉर द सेम नंबर ऑफ लाइफ बर्थ. डेवलपिंग कंट्री यानी कि हम लोग जैसे देश में 1 लाख बच्चा पैदा करती है औरत, तो उसमें से 232 औरत का डेथ हो जाता है. From commonly accepted indices, it is evident that infant, child, and maternal mortality rate are high in many developing countries. Further, much of the sickness and death among mother and children is largely preventable. By improving the health of mother and children, we contribute to the health of general population. These considerations have led to the formulation of special health services for mother and children all over the world. ठीक है. द प्रॉब्लम अफेक्टिंग द हेल्थ ऑफ मदर एंड चिल्ड्रन आर मल्टीफैक्टोरियल. डिस्पाइट करेंट एफर्ट, द हेल्थ ऑफ मदर एंड child still constitute one of the most serious health problem affecting the community, particularly in developing countries. The present strategy is to provide mother and children health services as an integrated package of essential health care, also known as primary health care, which is based on the principle of equity, intersectorial coordination, and community participation. The primary healthcare approach combines all elements of local community necessary to make a positive impact on the health status of the population, including the health of mother and children. So, mother and child, one unit. So, mother and child must be considered as one unit. It is because during the antenatal period, antenatal is जब प्रेग्नेंट है वुमेन, तो एंटीनेटल पीरियड में द फीटस इज पार्ट ऑफ द मदर. The period of development of fetus in mother is about 280 days. During this period, the fetus obtain all the building material and oxygen from the mother's blood. दूसरा क्या रीज़न है कि चाइल्ड हेल्थ इज़ क्लोजली रिलेटेड टू मैटरनल हेल्थ. A healthy mother brings forth a healthy baby. There is less chances for a premature birth, stillbirth or abortion. अगर मदर हेल्दी है तो प्री मेच्योर बर्थ नहीं होगा, स्टिल बर्थ नहीं होगा, अबॉर्शंस नहीं होगा. सर्टेन डिजीज एंड कंडीशंस ऑफ द मदर ड्यूरिंग प्रेगनेंसी. एग्जाम्पल, मदर को अगर सिफिलिस है, जर्मन मीजल्स है, ड्रग इनटेक कर रही है, आर लाइकली टू हैव देयर इफेक्ट अपॉन द फीटस. फोर्थ क्या है? After birth, the child is dependent upon the mother, at least up to the age of 6 to 9 months. The child is completely dependent on the mother for feeding. The mental and social development of the child is also dependent upon the mother. If the mother dies, the child's growth and development are affected. मैटरनल डेप्रीवेशन सिंड्रोम हो जाता है चाइल्ड को. फिफ्थ क्या है? इन द केयर साइकिल ऑफ वुमेन देयर आर फ्यू ओकेजन व्हेन सर्विसेज टू चाइल्ड इज नॉट साइमल्टेनियसली कॉल्ड फॉर. फॉर इंस्टेंस, postpartum care is inseparable from neonatal care and family planning advices. Hi, mummy. सो ये सब मिला हुआ है. जैसे बच्चा पैदा कर ली वुमेन, और उसके बाद वो जो न्यूनेट का केयर है वहाँ से लेके फैमिली प्लानिंग, ये सब कुछ एक इंटीग्रेटेड सिस्टम है. द मदर इज़ ऑल्सो द फर्स्ट टीचर ऑफ द चाइल्ड. इट इट इज़ फॉर दीज रीजन्स द मदर एंड चाइल्ड आर ट्रीटेड एज वन यूनिट. ठीक है, ये बता रहा था मदर और चाइल्ड जो है वो वन यूनिट की तरह क्यों ट्रीट की जाती है. सो दीज आर द 6 रीजन्स कि क्यों मदर और ये को ट्रीट करते हैं. आई डोंट हैव अ मार्कर. अगर मार्कर होता तो आई वुड हैव मार्क्ड. अच्छा कोई बात नहीं, आई मार्क विद द पेंसिल ऑन इटसेल्फ. Okay, so let's now go on to obstetric, pediatrics, and preventive and social medicine. So, in the past, maternal and child health services were rather fragmented and provided piecemeal personal health services by different agencies in different ways and in separate clinic. The current trend in many countries is to provide integrated maternal child health, and family planning services as compact family welfare service. This implies a close relationship of maternal health to child health, of maternal and child health to the health of the family, and of the family's health to the general health of the community. In providing these services, specialists in obstetrics, child health, pediatrics have joined hands and now looking beyond the four walls of hospitals into the community to meet the health needs of mother and child aimed at positive health. In the process, they have linked themselves to preventive and social medicine, and as a result, terms such as social obstetrics, preventive pediatrics, and social pediatrics have come into vogue. Yes, I'm a May. तो ऑब्स्टेट्रिक्स क्या है? ऑब्स्टेट्रिक्स इज लार्जली प्रिवेंटिव मेडिसिन। इट्स बेसिकली जब वुमेन प्रेग्नेंट होती है तो उसको ऑब्स्टेट्रिक्स कहते हैं। दिस अ प्रिवेंटिव मेडिसिन। द एम ऑफ ऑब्स्टेट्रिक्स एंड प्रिवेंटिव मेडिसिन इज द सेम। Why is it? To ensure that throughout pregnancy and puerperium the mother will have good health, ठीक है, that every pregnancy may culminate in a healthy mother and healthy baby. The old age concept that obstetrics is only antenatal, intranatal and postnatal care and is thus concerned mainly with technical skills is now considered as a very narrow concept and is being replaced by concept of community obstetrics, ठीक है, which combines obstetrical concern with concept of primary health care. So let's see social obstetrics क्या है. So the concept of social obstetrics has gained currently in recent years. It may be defined as the study of interplay of social and environmental factors and human reproduction, going back to preconceptual and even premarital period. The social and environmental factors which influence human reproduction are legion. Where is it? Age at marriage क्या है? Child bearing, child spacing, then family size, fertility pattern, level of education, economic status, custom and beliefs, role of women in society, ये सब क्या है? A study of these factors is an important aspect of social obstetrics. The social obstetric problem in India differ from social obstetric problem in developed countries because of various differing social, economical and cultural and other factors. While accepting the influence of environmental and social factors on human reproduction, social obstetric has yet another dimension, that is the influence of these factors on the organization, delivery and utilization of obstetric services by the community. In other words, social obstetrics हैं. फोकस सही नहीं है क्या? ओके, मैंने वाईफाई नहीं चलाया था. रियली सॉरी. वन सेकेंड. अब कैसा है फोकस? अब कैसा है फोकस? अच्छा, हम आगे पढ़ते हैं. देन उसके बाद क्या था कि organization, delivery and utilization of the obstetric services by the community. In other words, social obstetrics is concerned with delivery of comprehensive. ठीक नहीं है. दिख नहीं रहा है. सीरियसली नहीं दिख रहा है. Why? अब कैसा है मम्मी? अब दिख रहा है कि नहीं? आई गेस अब दिख रहा होगा क्योंकि जो हम कर सकते थे वो मैंने कर दिया. हाँ सही है ना? ठीक है. is concerned with the delivery and comprehensive maternal and child health care services, including family planning, so that they can be brought within the reach of the total community. सो प्रिवेंटिव पीडियाट्रिक्स क्या है? पीडियाट्रिक्स इस बच्चा हो गया है, उस बच्चे का केयर हम लोग कर रहे हैं. तो प्रिवेंटिव मतलब कि कुछ बीमारी आने से पहले ही उसको बचा दे रहे हैं. सो पीडियाट्रिक्स विच इज़ सिनोनिमस विथ चाइल्ड हेल्थ is that branch of medical science that deals with the care of children from conception to adolescence in health and disease. Pediatrics is one of the first clinical subjects to link itself to preventive medicine. Like obstetrics, pediatrics has a large component of preventive and social medicine. There is no other discipline so comprehensive as pediatrics that teaches the value of preventive medicine. Recent years have witnessed further specialization within the broad field of pediatrics, where that preventive pediatrics, social pediatrics, neonatology, perinatology, developmental pediatrics, pediatric surgery, pediatrics neurology, and so on. So, preventive pediatrics comprises effort to avert rather than cure disease and disability. So, effort to avert है, मीन इसका ये होता है प्रिवेंट करना है, डिजीज़ और डिसेबिलिटी को क्योर नहीं करना है. प्रिवेंटिव पीडियाट्रिक्स में डिजीज़ को आने नहीं देना. इट हैज़ बीन ब्रॉडली डिवाइडेड इनटू एंटी नेटल पीडियाट्रिक्स एंड पोस्ट नेटल पीडियाट्रिक. द एम ऑफ प्रिवेंटिव पीडियाट्रिक्स एंड preventive medicine are the same: prevention of disease and promotion of physical, mental, and social well being of children, so that each child may achieve the genetic potential with which she is born. To achieve these aims, Hospital for Children have adopted the strategy of primary health care to improve child health care through such activities as growth monitoring, oral oral rehydration, nutritional surveillance, promotion of breastfeeding, immunization, community feeding, regular health checkups. So, primary health care, which is potential for vastly increased coverage throughout an integrated system of service delivery, is increasingly looked upon as the best solution to reach millions of the children, especially those who are most in need of preventive and curative services. So, social pediatrics क्या होता है? So, social pediatrics is the challenge of the time. Let me eat something. बिन पूछे मेरा उम्र पता. ओके, तो हम लोग आगे पढ़ते हैं सोशल पीडियाट्रिक्स. सो द challenge of the time is to study child health in relation to community, to social values, and to social policies. This has given rise to the concept of social pediatrics. Social pediatrics has been defined as the application of the principle of social medicine to pediatrics to obtain more complete understanding of the problem of children in order to prevent and treat disease and promote their adequate growth and development through an organized health structure. Social pediatrics, like social obstetrics, covers a wide responsibility. It is It is concerned not only with the social factors such which influences child health, but also with the influence of these factors on the organization, delivery, and utilization of child health care services. In other words, social pediatrics is concerned with the delivery of comprehensive and continuous child health care services and to bring these services within the reach of total community. Social pediatrics also covers the various social welfare measures, local, national, international, aimed to meet the total health needs of a child. ठीक है. देन प्रिवेंटिव एंड सोशल मेडिसिन क्या होता है? सो PSM, प्रिवेंटिव एंड सोशल मेडिसिन विद इट्स इन्वॉल्वमेंट इन टोटल community care and expertise in epidemiology and in the methodology of collection and utilization of data relating to the community and to the environment makes an indispensable contribution to the social obstetrics and social pediatrics in the collection and interpretation of community statistic declining group at risk for special care. Then correlation of vital statistic, example maternal and infant morbidity and mortality rates. Then perinatal or child mortality rates. With social and biological characteristics such as birth weight, parity, age, stature, employment, etc., in the elucidation of etiological relationship. सो इसमें क्या है कि पहले एट रिस्क पॉपुलेशन को ढूंढेगा, देन वाइटल स्टैटिस्टिक जैसे कि मॉर्बिडिटी मॉर्टेलिटी है उसको बर्थ वेट पैरिटी और ये सब से हम लोग कोरिलेट करेंगे. देन स्टडी ऑफ कल्चरल पैटर्न बिलीफ प्रैक्टिसेस relating to the child bearing and child rearing, knowledge of which might be useful in promoting acceptance and utilization of obstetrics and pediatric services by the community. Now उसके बाद है to determine priorities and contribute to the planning of MCH services and programs, etc. Then for evaluating whether MCH services and programs are accomplishing their objective in terms of their effectiveness and efficacies. Then obstetrics, pediatrics, and preventive and social medicine were operating in watertight compartment. The emergence of social pediatrics, social obstetrics, and the association with preventive and social medicine are certainly new development in contemporary medicine. In some universities, a chair of social pediatrics has also been established. The increasing coming together of these disciplines augurs well for the provision of comprehensive mother and child health care and family planning services as a compact family welfare services. Now let's move on to maternity cycle क्या होता है. ठीक है. So maternity cycle the stages in maternity cycle are पहला fertilization होता है, दूसरा antenatal and prenatal period होता है. Then third is intranatal period, fourth is postnatal period, and fifth is conceptional period. So fertilization takes place in the outer part of the fallopian tube. Segmentation of the fertilized ovum begins at once and proceeds at a rapid rate. The fertilized ovum reaches to the uterus in 8 to 10 days. Cell division proceeds at a rapid rate. By a process of cell division and differentiation, all the organs and tissues of the bodies are formed. The period of growth have been divided as follow: prenatal ovum 0 to 14 days, एम्ब्रियो 14 से 9 वीक तक एम्ब्रियो कहते हैं. और फीटस किसको कहते हैं? अच्छा, फॉरेंसिक वाले सर ने हमें हमें पूछा था कि एम्ब्रियो क्या होता है, फीटस क्या होता है, एंड मैंने पता नहीं क्या क्या बोल दिया. सो एम्ब्रियो इज़ 9 वीक. 9 वीक इज़ लाइक 2 मंथ्स. 2 महीने तक हम लोग उसको एम्ब्रियो कह सकते हैं. और 2 महीने से ले करके पूरा बर्थ तक उसको फीटस कहेंगे. ठीक है. फिर प्री मच्योर इन्फेंट कब होता है? 28 to 37 वीक्स प्री मच्योर होता है. और बर्थ फुल टर्म एवरेज 280 डेज. MCH प्रॉब्लम्स क्या क्या है पहले ये देख लेते हैं. पहला है माल नरिशमेंट, दूसरा है इन्फेक्शन और तीसरा है अनकंट्रोल्ड रिप्रोडक्शन. ठीक है. हम लोग ना ये वाला पढ़ के एंटी नेटल केयर के ऊपर तक यहाँ तक पढ़ेंगे एंड देन वी विल टेक लाइक 5 minutes ब्रेक एंड देन वी विल स्टार्ट अनदर सेशन जिसमें एंटी नेटल का पूरा रहेगा. फिर इंट्रानेटल करेंगे. तो फर्स्ट पार्ट इज़ हम लोग देख लेते हैं कि हम लोग का हमारा प्रॉब्लम्स क्या है. MCH प्रॉब्लम्स. So, maternal and child health problems covered a broad spectrum. At one extreme, the most advanced countries are concerned with problems such as perinatal problem, congenital malformation, genetic and certain behavioral problem. At the other extreme, in developing countries, the primary concern is reduction of maternal and child mortality and morbidity, spacing of pregnancy, limitation of family size, prevention of communicable disease, improvement of nutrition, and promoting acceptance of health practices. Currently, the main health problem affecting the health of the mother and the child in India, as in other developing countries, revolve around the triad of malnourishment, malnutrition, infection, and the consequence of unregulated fertility. Association with these problems is the scarcity of health and other social services in vast areas of the country together with poor socio-economic condition. Now malnourishment देखते हैं. malnourishment का क्या? Hi मम्मी. सो माल नरिशमेंट इज लाइक एन आइसबर्ग. एक आइसबर्ग की तरह मोस्ट पीपल इन द डेवलपिंग कंट्रीज लिव अंडर द बर्डन ऑफ माल नरिशमेंट. प्रेग्नेंट वुमेन, नर्सिंग मदर, child are particularly vulnerable to the effect of malnourishment. The adverse effect of maternal malnourishment have been well documented: maternal depletion, low birth weight, anemia, toxemias of pregnancy, postpartum hemorrhage, all leading to high mortality and morbidity. The effect of malnourishment are also frequently more serious during the formative years of life. Previously, it was thought that malnourishment was largely concentrated in school age children and in toddlers. Now it is realized that intrauterine period of life is a very important period from the nutritional standpoint. Infant born with adequate birth weight have relatively low mortality even under poor environmental condition. The next crucial period of childhood is the period of weaning. वीनिंग वो होता है जब ब्रेस्ट मिल्क छोड़ करके उसको खाना खाना होता है. ठीक है. So severe malnourishment coincides with the age at which babies are usually weaned. Susceptibility to infection and severity of illness are significantly less in well nourished than in malnourished children. Nutrition protection and promotion is therefore an essential activity of MCH care. So, measures to improve the nutritional status of mother and children may be broadly divided into direct and indirect nutrition intervention. Direct intervention covers a wide range of activities जैसे कि supplementary feeding program, distribution of iron and folic acid tablet, fortification and enrichment of food, nutritional education. और indirect जो होता है nutritional have still wider ramification because they are not specifically related to nutrition. These include measures to control communicable disease through immunization, improvement of environmental sanitation, provision of clean drinking water, family planning, food hygiene, education, and primary health care. Nutritional surveillance is becoming increasingly important in identifying subclinical malnourishment, as it tends to be overlooked in both mother and the child. Uh, Health worker, community worker can play a vital role in improving the nutritional status of mother and child. अब हम लोग देख लेते हैं, माल नरिशमेंट तो हो गया, अब हम लोग इन्फेक्शन देख लेते हैं. सो इन्फेक्शन में क्या है? Maternal infection may cause a variety of adverse effects such as fetal growth retardation. माँ को अगर इन्फेक्शन होगा तो बच्चे का ग्रोथ रिटार्डेशन होगा, लो बर्थ वेट होगा, एम्ब्रियोपैथी होगा, अबॉर्शन होगा, puerperal sepsis हो सकता है. In industrial societies, the risk of mother acquiring infection during pregnancy is relatively low. But in underdeveloped areas, the mother is exposed to significantly higher risk. Many women are infected with HIV, hepatitis B, cytomegalovirus, herpes simplex virus, or toxoplasma during pregnancy. Furthermore, about 2 to 10% of the pregnant women suffers from asymptomatic bacteriuria. ठीक है. सो अब इन्फेक्शन का देख लेते क्या है कि एज फार एज द बेबी इज कंसर्न, इन्फेक्शन मे ब्रिंग विथ labor and delivery, and increases the child growth and increases as the child growth older. Child may be ill with debilitating diarrhea, respiratory and skin infection for as much as third of their first year of the life. In some region, the situation is further aggravated by chronic infections such as malaria, TB. The occurrence of multiple and frequent infection may precipitate in the children severe protein energy malnourishment या फिर anemia. When the child becomes ill, tradition, belief and taboos enter into play. The indirect effect of infection may be more important than the direct one in traditional societies. Thank you, Ame. So, prevention and treatment of infection in mother and children is a major and important part of normal MCH care activity. So it is now widely recognized that children in developing area needs to be immunized against 9 infections. ठीक है, 9 infections: TB, diphtheria, whooping cough, tetanus, hepatitis B, Haemophilus influenza type B, Japanese encephalitis in endemic states, measles, polio. Many countries, including India, have adopted the WHO expanded program on immunization as part of everyday MCH care. Okay? So, tetanus toxoid application during the pregnancy has also been taken up. Education of the mother in medical measures such as oral rehydration in diarrhea, febrile disease. In addition, a good knowledge and practice of personal hygiene, appropriate sanitation measures, particularly in and around home, are essential and prerequisite for the control of most of the common and infectious parasitic disease. Now, uncontrolled reproduction क्या होता है? So, uncontrolled reproduction is the health hazard for the mother and child resulting from unregulated fertility have been well recognized. अनरेगुलेटेड फर्टिलिटी मतलब बहुत सारा बच्चा करते जाना. सो क्या होता है, इंक्रीज्ड प्रेवलेंस ऑफ लो बर्थ वेट बेबीज़ होने लग जाता है. बहुत सारा बच्चा होगा तो लो बर्थ वेट बेबीज़ ज़्यादा होगा. सीवियर एनीमिया होगा मदर को. अबॉर्शन होगा. एंटी पार्टम हेमरेज होगा. हाई मेटर्नल एंड पेरी नेटल मोर्टैलिटी होगा, which have shown a sharp rise in the fourth pregnancy. Fourth pregnancy में काफ़ी बढ़ जाता है. Statistics have shown that almost every country in the world, a high birth rate is associated with high infant mortality rate and under 5 death rate. सो इंडिया में अगर हम लोग देखेंगे क्रूड बर्थ रेट पर 1000 पॉपुलेशन 16 है. पाकिस्तान में 28 है. बांग्लादेश में 20 है. और इन्फेंट मोर्टैलिटी रेट इज़ 23 इन इंडिया. अंडर 5 मोर्टैलिटी रेट जो है दिस इज़ 29. ओके, आगे बढ़ते हैं. बिकॉज फैमिली प्लानिंग हैज़ अ स्ट्राइकिंग इम्पैक्ट ऑन the health of mother and the child, a number of countries have integrated family planning in the MCH care activities. The introduction of new type of IUD, easier and safer technique of pregnancy termination and female sterilization, oral pills, long acting injectable, and medroxyprogesterone acetate have contributed to a good deal in the utilization of family planning services. In some countries, MCH program are extending their scope to include family life education in school. There is also an increasing acceptance of the role of traditional midwife and community health worker with suitable training for the extension of family planning services to remote rural areas. Now, maternal and child health care, the term maternal and child health MCH जो होता है refers to the promotive, preventive and curative and rehabilitative health. 4 वर्ड्स है क्या? प्रमोटिव, प्रिवेंटिव, क्यूरेटिव, रिहैबिलिटेटिव. Health care for mother and children includes the sub areas of maternal health, child health, family planning, school health, handicapped children, adolescent, and health aspect of care of children in special settings such as daycare. The specific objective of MCH are reduction of maternal, perinatal, infant and child mortality and morbidity, promotion of reproductive health, and promotion of physical and psychological development of the child and adolescent within the family. The ultimate objective of MCH services is lifelong health. Pregnancy detection. The simple way to confirm pregnancy is in the first trimester is to conduct a urine examination using pregnancy test kit. The kit detects pregnancy on the basis of the presence of human chorionic gonadotropin hormone, HCG जिसको कहते हैं, in the urine. The test is performed soon after a missed period and is simple to perform. The pregnancy test should be offered to any woman who is in reproductive age group and comes with a history of amenorrhea or symptoms of pregnancy. The government of India has made Nishchay pregnancy test kit available across the country. Other test kits are also available in the market. The kit is provided to ASHA or other link workers, and the women should be advised appropriately on the result of the test. ओके गाइस, सो हम लोग एंटीनेटल केयर शुरू करेंगे बट 10 मिनट बाद. ठीक है, बाय.